All right. Hey there. Welcome to our channel at Merus Gastroenterology and Gut Health. I'm your host, Dr. Sumanamoole. Today, I'm excited to have a wonderful host, Dr. Funke Afolabi Brown from Philly. And I'll give a brief introduction and I'll let Dr. Brown also add in anything that I might have missed. Dr. Brown is board certified in pediatric pulmonary medicine and sleep disorders. She is a speaker and educator, a writer, and the founder of Restful Sleep MD, where she helps busy professional women and their children prioritize sleep to not only achieve their optimal health, but also thrive and live to their fullest potential. She does this through courses and programs focused on educating and empowering busy professional women to make sleep a priority and as a critical pillar of their overall health. Dr. Brown is also a member of the American Academy of Sleep Medicine, the American Academy of Pediatrics, and the American Thoracic Society. And she serves on several committees locally, regionally, and nationally. Wow, that's quite a CV. Dr. Brown, welcome. I'm so excited to have you. And is there anything you would like to add to that and a little bit about you for us?
Thank you so much for having me. No, you're so kind. I'm looking forward to our conversation.
Absolutely. Yeah, no, this is wonderful because sleep is such a common topic that common, it's everybody, right? It's everyone. Yet it is often so to say, I guess, misunderstood the importance of it, or how do we even take care of it? Is it something on our mind? I mean, do we even need to pay attention to it? We sleep if we can't stay awake anymore. I guess very few people consider as there is a hygiene, a sleep hygiene, or routine, or the importance and impact of sleep. Now, could you tell us a little bit about the patient population you see and what common problems you see with lack of sleep, and then we can take it from there.
Sounds good.
Why is it important? Yeah.
No, sounds good. And I like what you said. A lot of people consider sleep as something they do when they can't stay awake anymore. And that's actually the unfortunate truth, right? We push ourselves to the point where we are exhausted and then we just try to fall asleep. And if you're exhausted enough, you might be able to sleep through the night, but the goal of sleep is not just to do it until we're exhausted, but to see it as something that is part of our health and our well-being, right? Like the same way we're focusing on nutrition and exercise and physical activity, we're prioritizing all those things. We have to see sleep as that. We have to approach it with intentionality, because unfortunately fortunately, right, everybody sleeps, so eventually you will sleep, right? You will drive yourself to the point where you're tired and fall asleep, but most people have not really been able to harness the power that is available to them when they sleep well, like in terms of understanding the benefits and really approaching sleep in a way that they can get the maximum benefits from. So what I mean by that is many times, especially in this 24-hour globalization we're in, right? Most people are trying to hack sleep. So trying to find ways to not sleep, trying to find ways to
all the energy drinks and everything else.
Exactly. So that's one. Trying to combat, even though they wake up feeling exhausted and maybe they have sleep apnea, maybe they have a medical disorder, not really paying attention to it. And so what that ends up doing is people are tired, people are exhausted, and their own physical health is being affected. Their mental health, their emotional health, all that gets affected eventually. So I say sleep is not just a cure for sleepiness, it affects so many organs and systems in our body. In terms of who I see, so my employed job currently focuses on children with sleep disorders, but I also have my business, which is Restful Sleep MD, where my real focus is coaching women, moms actually, so high achieving moms who are doing everything for everybody else and are not really making time for themselves to rest, for themselves to sleep. And so that's really been a focus of mine. And what we've been doing is changing that narrative around, oh, sleep is something that's dispensable, to
Mm-hmm.
see that sleep is something that has to be a focus. And then we build everything else knowing that we've prioritized our sleep.
Mm-hmm. Yeah, that's
Mm.
fantastic. Yeah, especially young. Now, when you say moms, are you talking about young moms with new babies where definitely sleep is an issue and they don't get much sleep, or also older moms like in their 40s, maybe even in their 50s? Is it
Yeah,
everyone? Mm-hmm.
yeah, it is, because I think once you get that title mom, right? At least for
Yeah.
me personally, that was what
Yeah.
happened. My life my
Yeah. Oh,
life has
yeah.
never been the same, right? So at the beginning, first you're pregnant with them,
Yeah.
right? And you're not sleeping because you're pregnant, because
Right.
you're using the bathroom frequently, and you have restless leg syndrome, and you're worrying about when they come to life and how you're going to feed them and take care of them and parent them, right? And
Mm-hmm.
then they show up. And then you're not sleeping because they're not sleeping, and they want you to rock them and feed them and do, right? And then maybe they have some medical issues.
Mm-hmm.
And then they become toddlers and you're still not sleeping because now they want an extra hug, or there's a elephant or a lion or a monster under their bed and they're
Right.
scared of the dark, and they just push back, or they just cannot sleep because of one thing or the other, right?
Mhm.
And then fast forward, they become teenagers and you can't sleep because they're not coming home till very late at night, and they're coming in past their curfew. And they're having to wake up super early in the morning because they have to go catch the bus, and then they leave the house, and then you're an empty nester, and then
Now this is
menopause
the
sets in.
menopause, right?
So so for all those stages of life, right? Once you get that title, right, your life just changes and your sleep does change. So
Yeah.
a lot of my focus is across that
Okay.
entire lifespan, honestly.
Full spectrum.
I see a lot more around, again, school, of course, the babies, the school age
Mhm.
children, moms of teenagers and things, which so a
Mhm.
lot of my moms are probably in their, anywhere from their 20s to
Mhm.
about 50s or so, when they start to have more of the
Mhm.
perimenopausal problems and things like that.
Mhm.
Yeah.
Mhm. Mhm. Is there, so these moms, of course, dads can also have not, sleep problems, but we are focusing in one area and a lot of
Yeah.
things probably overlap. It's the
Yeah.
same things.
Mm,
Is there like the difficulty in falling as I know there's like you separate them into probably difficulty falling asleep, staying
mm,
asleep, or waking up too early. Um,
mm.
does it change between the ages of these parents going through the different stages of their life cycle, or anything could be anywhere? It really depends. Mm.
Yeah. So that you just described perfectly as insomnia, right? And so that's one sleep issue that
Mhm.
quite common, actually, that moms experience, which is insomnia. And it
Mm.
changes. One person can have all three.
Mhm.
Sometimes it could be an issue that's just really present at bedtime. Sometimes it's present in the middle of the night. Sometimes they're waking up early. So for
Mhm.
everyone, it varies. And
Mhm.
then on top of that, it all depends on what else is going on in your life. So it may not be,
Mhm.
the kids may be perfect sleepers
Mhm.
up, right? It could be that you are struggling with like stress and anxiety and things, so your mind may be racing.
Mhm.
Or it may be that you've just not been able to take care of yourself. You're bringing work into bed with you, or you're having issues with saying no, and it's now become a thing where you're not getting into bed till very late and you're having to wake up early in the
Mhm.
morning.
Mhm.
And in some cases, it may be trauma, right? A lot of women may have undergone some traumatic experience and now they have anxiety. And so then the anxiety or the depression or the mood disorder is occurring concurrently
Mhm.
with sleep issues, where they just don't feel safe. They have this heightened sort of cognitive arousal that makes it
Mhm.
hard for them to sleep. So it literally does vary.
Mhm.
And then,
Mhm.
of course, in addition to that, there's the sleep disorders, right? There might be sleep apnea or restless leg syndrome, especially as we get older. No more are we thinking that sleep apnea is just something that happens to, like, overweight middle-aged men, right? Women have sleep apnea as well. So those are all things that can contribute to sleep problems.
Yeah, that's
Mm.
amazing how many things can the primary disorders as well as just lifestyle, like you
Yeah,
said, and
yeah.
the behind the scenes, what's going on in our life, stress or what have you. Um,
Mm,
but that which is important, which I think pertains to all of us. We could be, I guess, good sleepers for some time and then switch when
mm,
stressful events happen, something else.
mhm.
What are some of like the common things you see in your patient population that is impacting sleep? Not the primary the sleep disorders, but so to say lifestyle factors. And
Mm,
what could we do to
mm.
look for them and maybe try to help ourselves
Yeah,
correct them?
yeah, no. So, what my clients typically will come to say is, I can't sleep, or I'm having sleep issues, right? They just know they are, or I'm
Mhm,
tired, right? I'm exhausted, I'm sleepy, I'm not
mhm,
sleeping well at night. And so
mhm,
we do a lot of detective work because
mhm,
they are just like, I can't, I've done everything. I've taken melatonin, I've taken
mhm,
cherry juice, I've taken all sorts of over-the-counter sleep
mhm,
aids, I'm doing everything else, right? And so we then just kind of peel a lot of those layers off and say, okay, what is the main problem, right? Like you
mhm,
said, is it problem falling asleep? Is it problem staying asleep? Is it early wakefulness? And then
mhm,
I kind of go through like, what are your sleep habits? What are you doing before bed? For me, I actually tell people, I'm like, think of me like I'm like a fly in the wall in your house. Like I
mhm,
want to know all the details because every single thing
mhm,
contributes right from actually when you wake up, adds to why you're having sleep issues, right? When you wake up, what do you do? What's your day like? Do you spend time outside, right? What are you eating? Um, what's your how do you manage stress, right? How's your workload at work, right? All those little things. What do you do at bedtime? Do you have a routine? Do you get into bed with
mhm,
your phone, with your laptop? All those, every single piece of that
mhm,
helps me know, okay, this is where the problem is. Then of course we talk about like the medical sleep issues as well,
mhm,
right? So all those things then help me know, right? And so
mhm,
based on that, I then what helps me, because I like, and this is one thing I always help my moms also understand is let's simplify these things. So
mhm,
the way I have it is we have three main categories of sleep problems.
mhm,
So the first category is what we've talked about already, right? If you have
mhm,
a medical sleep problem, right? We can't move forward until we address that. If you have insomnia, or if you have
mhm,
sleep apnea or narcolepsy or delayed sleep wake phase syndrome,
mhm,
or things like that.
mhm,
So we all any medical issue, if you have thyroid problems, right? If
mhm,
you're menopausal, perimenopausal, if you have those, right? If you're on medications, diuretics, blood pressure medicine, I'm taking that into that first category, right? Because all those things can affect your sleep. And
mhm,
then the next category is sort of the behavioral piece, right? So what you were saying, like, are there habits, right? Are
mhm,
you spending all day in bed and wondering why you're not sleeping at night? Are
mhm,
you drinking caffeine before bed? Is your room dark enough? Are you addressing any alcohol intake? Are so we're going through all those things. Are you using your phone in bed? So those are sort of more behavioral and habits and things like that. Does your child need you constantly in the room for them to fall asleep? Is your
mhm,
child bringing, is your
mhm,
child pushing back at bedtime? Is your child demanding for more electronics time at bedtime? So that's sort of the behavioral category.
mhm,
And then the last is kind of what's present all the time. So it's present during the day and also has its manifestations at night. And usually what I put into that category is things like anxiety,
mhm.
right? Or depression,
Yeah.
or in our kids, maybe things like ADHD or autism. So all those things have their manifestations. They're there already during the day, but
Mhm,
at night it kind of has its own unique
mhm.
presentation.
Yeah.
So once we do that, then based on that sort of detective work of your sleep history,
Mhm,
your sleep habits, then we can delve down to say, this is where it falls in. And sometimes it's a combination of everything.
mhm, mhm. Yeah.
Yeah.
Yeah. Yeah, it does seem like detective work trying to get so many pieces and see where is it that we
Yeah.
could make some impact, change and make some impact. So for these medical disorders, I'm thinking, do they need like a sleep study to diagnose? Just um, yeah,
Yeah, yeah, some
or not?
do. So
Uh-huh. I
so
see.
so it
Not
all
all, not all.
depends. Yeah,
Okay.
not all. Yeah.
Okay.
So if you have sleep apnea, right, then we
Uh,
do need like a sleep study. And the
right.
sleep study could either be a home sleep test, right?
Mm-hmm.
We have the sleep apnea kits that you could have at home and you set up in the comfort of your own home.
Mm-hmm.
Or it might be an in-lab sleep study. So
Right.
that's kind of, especially in children, because they
Mm-hmm.
move around a lot, we need a little bit more monitoring. So they end
Mm-hmm.
up needing to come into the sleep lab for that.
Mm-hmm.
Disorders like narcolepsy, for instance, involves a a sleep lab test, and
Mm-hmm.
then what we call a nap test, because narcolepsy is just this uncontrollable need to sleep. You're just like exhausted all the time, and so you may
Mm-hmm.
need you need a what we call a nap test. So it's a 5 day, it's a whole day affair. You come in the night before and then you stay the next day, and we can make that diagnosis. So depending on what's going on, you
Mm-hmm.
may or may not need a sleep test. If you have something like insomnia, then you don't need a sleep study.
Mm-hmm.
If
I
you have
see.
restless leg syndrome, which is that creepy crawly sensation you might have in your
Mm-hmm.
legs at bedtime, you don't need a sleep study.
Mm-hmm.
So I think that's really helpful, because and that's a great question, because I've had people come and say, I can't sleep. My doctor said I should get a sleep study. And I'm like,
Mm-hmm.
you don't need a sleep study. I don't need you to do a sleep study to show that you can't sleep, right? You just told me you can't sleep.
Right.
So
Right.
in that case, we're working more on, is there behavioral stuff going on? Is there,
Mm-hmm.
what else can we address and things like that?
Mm-hmm. Mm-hmm.
Mm.
Yeah. No, that's very useful. Um, are there like any supplements that actually do help sleep? I guess that only comes after you adjusted and modified any behavioral things and corrected as much as you can, right?
Exactly.
Yeah.
And that's why people come and they're like, I've taken 20 different supplements, and they come with a big bag of all the supplements, because you're like, it's like we're putting the cart before the horse. We have to
Right.
know what we're dealing with, right? And of course, it seems harmless because it's like, oh, it's supplements, it's all natural,
Mhm.
right?
Yeah.
And so most people are like, well, let's try, because
Mhm.
most people want an answer right away.
Mhm.
And so usually what I recommend, instead of finding that quick fix, is let's try to delve into why this is happening,
Mhm.
what's going on. And this takes time. This is why I
Yeah.
started my coaching program, because this is not what you would see in a 30-minute clinic
Right.
visit,
Yeah.
right?
True. That's a
You
lot of
just get it.
information.
No,
Yes. Yeah.
exactly, because all you get is a script for, okay, this is a sleeping
Mhm.
medicine. Good luck, right? But
Right.
here we're doing so much more.
Yeah.
And so it's like, why are we needing melatonin? What is going on with your sleep, right? Is there a medical sleep problem? In which case, buckets of melatonin is not going to fix that, right?
Mhm.
Is it iron? Is it low iron levels, right? Is it low vitamin levels? Is it gut issues, right? Is
Mhm.
it,
Yeah.
things like that, right?
Mhm.
So then we're trying to address all those so that
Mhm.
it doesn't feel like we're putting a band-aid. There are specific conditions where melatonin is recommended, right? So if you have things like we call it a delayed sleep-wake phase syndrome, which is sort of like the night owl syndrome, because some
Mhm.
people just cannot sleep until much
Mhm.
later. And if they sleep at that later time, they are perfectly fine. They just have to wake up late in the morning.
Mhm.
So if you have that, then yes, you should be on
Mhm.
melatonin. If you have shift work sleep disorder, so if you're a shift worker
Mhm.
and you are now on even on a normal schedule, you're not able to sleep, yeah, you should
Mhm.
probably be on melatonin in consultation with your doctor.
Mhm.
If you have jet lag, right, you can do that. If you have kids who have autism or ADHD or some of these other developmental
Mhm.
conditions, yeah, it might be
Mhm.
time to use melatonin, right?
Mhm.
Um, some of the other supplements, the research is just not strong enough. Some people do
Right.
report they feel a little bit better with things like valerian root or
Mhm.
some of those things. And my recommendation is speak to your doctor to see if that's really an option for you, because some of them actually interact with other medications. So you just really want to be careful, even though they're natural. Like
Right.
sometimes they contain other sort of substances that may potentially interfere with maybe some medications or the other that you're on.
Do I see like a lot of uptick in ashwagandha these days? I'm not sure if I'm the only one or everybody talks somehow about ashwagandha. Is that any way related to sleep, or is it more a I guess it's I heard it decreases cortisol, like the stress hormone, along with
Yeah.
rospulia, but I didn't know if it had anything with sleep or not so
Yeah,
much.
I mean, that's one thing that we know with sleep, especially with insomnia, is that, or with just, that increased feeling of stress. It can affect your sleep because cortisol levels are supposed to go down for you to fall asleep, right? In the evening, and then in the morning it starts to rise, right? That flight or flight. That's why you're ready to go. But if you have a consistently high cortisol level, right, that's increasing your sort of your sympathetic nervous system. So you're constantly
like
feeling very
type.
aroused, right?
Yeah.
So anything that you do, right, that can decrease that stress level, whatever that looks like, it does not have to be a supplement. If you need to, that's fine. And if it's safe. But if you want to do some mindfulness, some yoga, some meditation, some prayers, a bath, or having a routine in and of itself, or during the day, setting up boundaries, right? Figuring out what is stressing me and trying as much as possible to eliminate or limit your constant exposure to that stress. All those things will help you to sleep better at night.
Makes sense. Makes sense. You mentioned about the delayed sleep phase syndrome. That sounds like my teenagers. Is it true that most teens have that? Is it kind of natural
So
or?
no. Yes. So this is the thing. Most teenagers around puberty, they have a shift in their circadian rhythm where their bodies just don't produce that. That melatonin is that sleep hormone that's produced in the evening, right? It rises in the evening and then it falls and then you wake up in the morning. And that's really aligned with our circadian rhythm. Our teenagers around puberty have a shift, right? So instead of, say, for instance, I'm just giving you an example. Typically, maybe your melatonin production starts around 6 p.m. or around sundown or 7 p.m. Our teenagers get a shift where it may not necessarily be rising until like maybe 9 or 10. And so they don't feel sleepy until 11 p.m. And it's not like they're trying to be, they're misbehaving or they're up to no good. They literally physiologically can't sleep. And so, yes, it's very common. Usually over time, say by the time they go through puberty and, later in their teen years, around 18, 19, 20, it starts to normalize again. And if your teen could choose their sleep schedule, this would not be a problem. Because they would go to bed at 12 midnight, which is when they are more likely to fall asleep. And they would wake up at 8 a.m. or 9 a.m. and the world would be perfect. But then our school system doesn't allow that. Our culture supports morning people. And most teenagers are not morning people, right? So that's where the fight comes up. You're forcing them to go to bed at night when they can't, and then you're waking them super early when they're in what we call their circadian nadir, and we're wondering why they're grumpy.
Yeah, absolutely. Yeah. I wish they could have later, I guess, school times for high schoolers, right?
Exactly. You said it. So many organizations now, the CDC, the American Academy of Sleep Medicine, the American Academy of Pediatrics, so many organizations have already said we need later school start times for our teenagers. And many school districts in some states have already gotten it approved, but it's still a work in progress.
Yeah. Awesome. Yeah. So that was, I mean, you touched on so many points, and I'm learning as I'm speaking to you. It affects everybody. It's amazing. But to help us wrap up, can you give us like an example of a good evening routine for a good sleep, which say most people, there's not many stressors outside. What would a good routine look like?
Absolutely. So I think the most important thing is find something that is pleasurable for you. And if it's for your kids, have them involved. What I define for a routine is 2 or 3 calming and relaxing activities that head in the direction of the bedroom. So it might start with a snack. If you had dinner early, you could have like a little snack, and then you go on to the hygiene piece. I usually say start with the hygiene piece, maybe take a bath or a shower, brush your teeth, get into your PJs or something comfortable, right? Take off whatever you've had all day on and do that. And then the next, usually I would recommend is something that helps with connection, right? So this would be the time either to speak with your spouse or your children or family. If your kids are asleep by then, just engaging in some meaningful community or communication, if that's something that works for you. And then the third, usually I would recommend is some type of mindfulness activity. So, again, if that's reading a book or just journaling, gratitude is a big one, going through your day and thinking of things, because our minds tend to go to the things that didn't work well during the day. And those things make us, those thoughts beat us down and make us feel like, oh, I didn't get much done. But find things to write. I usually recommend having a gratitude journal where you can write down what you're thankful for, or pray or meditate. For me, I read my Bible, so I would read my Bible around then. So that really just gets me very calm. If you want to read a book, you can read a book. So find those systems, and you may need to play around with it. Some people will turn on certain calming music or like an audio book or a podcast that's relaxing for them, right? So finding what works for you, and then just sticking to it. If you notice that you're not looking forward to it, then it might be time to shift it a little bit. The important thing is doing it consistently, because what that does is it cues our brain for sleep.
Awesome. Wow, those are really, I'm mentally taking notes as you're talking for my own sleep, but I think that's something we can definitely all of us implement and have good sleep, and that affects everything. The next day's work life, our mood, our relationships, everything, right? Based on good sleep or not. Yeah, kids are grumpy. I wonder, oh, maybe she didn't sleep. So yeah, all of this goes back to how important that sleep is. But thank you so much for the wonderful words of wisdom and the pointers that we all can use in our daily life and help improve sleep. Where can people find you if they're looking to get some more information, maybe connect one-on-one?
Yeah, absolutely. Absolutely. Thank you for having me. So my website is a good place to start. So my website is restfulsleepmd.com.
Got it.
One word, restfulsleepmd.com. And so on there, I have a blog. And also if you're a mom who is just struggling with sleep, like a lot of what we just talked about was barely scratching the surface.
Yeah.
So I work one-on-one with women. I have a coaching program that helps us really I help you delve into the details. First, the limiting beliefs or patterns or habits that may be getting in your way of sleep. Then we go through the system like I just talked to you about. Get you sleeping better. And so you can get on a free call, and just kind of chat, and we could see if I could help and how I can help you get to sleep better. And then also I'm on social media, Restful Sleep MD, and then I'm on Facebook at Dr. Funke Afolabi Brown. So those are the main places.
Add all of those links as well. Yeah.
Perfect.
Yeah.
Perfect.
Awesome. Thank you so much for coming on. I really appreciate it. It was so much fun.
Thank you. Thanks for having me.
All right.
Take care.
Thank you for listening. Yeah.